Hi guys, my name is Chelsea Gregory. I'm a registered nurse here at Shadowville, and today I will be presenting on community safety, housing, and food access issues within Shadowville itself. This lesson will focus on all of those factors, the environmental factors, risk, and strategies to improve health outcomes. Environmental conditions play a major role in overall health and safety. Guys, by the end of this lesson, I want you guys to be able to identify risks, describe housing-related health concerns, and explore strategies to improve access to healthy food. These align with population health principles. I also, guys, want you to be able to recognize strategies to prevent these things from happening and occurring. The community assessment that I did before on a previous assignment helped to identify the priority health issues. In this case, unsafe environments, poor housing, and limited food access are key issues contributing to health disparities within Shadowville itself. Right now, we're going to look at the environment. It's important to understand that everyday hazards such as poor lighting, uneven sidewalks, and poorly maintained public areas can significantly increase the risk of falls, injuries, and even crime within the community. So when I looked around at the Shadowville bus stop in the low-income area, there was debris on the ground. The bench was exposed to the elements of outside. There were cracks in the pavement, and there were also limited lighting, so that could lead to crime. It could lead to injury. It could lead to, someone becoming sick from being exposed to the elements, such as if it were raining and they need to catch the bus or whatever the case may be. These risks don't affect everyone equally. Like I said, vulnerable populations such as children, older adults, and individuals with mobility challenges are specifically at high risk for these preventable injuries. Thinking beyond just physical harm, unsafe environments can contribute to increased stress, anxiety, and fear. For instance, if I go to the bus stop and I see that it's raining, or I see that the conditions are not up to par, or I feel like I'm not safe, then that will prevent me from catching the bus, which may be my only means of transportation to go to work or school or to the grocery store or to the doctor's office. And so I might neglect my needs and I might not go. And it'll just negatively impact your overall quality of life. Additionally, environmental neglect can accumulate trash, lack of sanitation, which can attract pests, which no one likes bugs. No one likes to be around rodents or rats, or some people are allergic to cats. And so it might bring along all of these other factors into there, which can further impact the environment. Because of this, improving the environment safety through better infrastructure, regular maintenance, and community involvement is essential. Public health efforts that focus on creating safer environments can reduce injury rates and support healthier, more secure communities overall. Then we go to poor housing conditions, such as overcrowding, structural damage, can significantly increase the spread of infectious disease during the close contact with inadequate ventilation. One area I saw of issue was the Shadowville school. There was water on the floor, it was mold, there were things of that nature which can lead to respiratory illnesses, and it can dampen the environment, which increases asthma and chronic bronchitis. Inadequate sanitation and waste management can contribute to gastrointestinal illnesses and attract pests, which further increases the risk of disease transmission. Additionally, substandard housing can also, again, increase stress, mental health challenges, and overall reduce the quality of life in poor income populations. Once these issues are essentially addressed through public health interventions and community resources, it's essential to reduce health disparities and improve long-term health outcomes. Poor housing conditions are associated with, again, respiratory illnesses and chronic diseases. So it's important that when we see something, we say something. If we're going through the vestibule of our apartment building and we see, oh, hey, it's a little dark circle there, we have to mention those things to sanitation, mention those things to housekeeping, mention those things to environmental services so that they can address the issue and mitigate it before it spreads into something more. Continuing on, we're going to talk about food access issues. In Shadowville, I noticed that they did have a restaurant, which was like a little burger joint, which is nothing wrong with that. It's nothing wrong with eating out every now and then. But their grocery store was closing, and so that meant that their access to vegetables, fruit, grains, oats, anything that is essential and nutritious was limited. So, when we talk about food deserts, they occur when individuals lack access to affordable, nutritious foods. This can lead to poor diet quality, increased risk of chronic diseases. Limited access to food, healthy food, I should say, often refers to living in a food desert, and it can lead to poor dietary intake and increased reliance on processed, low nutrient-rich foods. This lack of access is associated with higher rates of chronic conditions such as obesity, diabetes, and cardiovascular disease. So this was open up a entirely new keg of worms that the people of Shadowville don't necessarily need. This also ties into the transportation aspect. So we have a poorly managed transportation area for people to catch the bus or taxi or even Uber. And then we have a lack of a grocery store on this one particular side of town. So these people are fighting with double-edged swords. They're fighting to, be able to catch the bus safely or catch transportation safely, and then they're lacking the proper food that they need to maintain. Higher costs of fresh foods also contribute to food insecurities in low-income communities. Food insecurities not only impact physical health, but is also linked to increased stress, anxiety, and negative mental health outcomes. Expanding access to community resources such as food banks, nutrition assistance programs, and local markets are essential to improving overall health and reducing disparities. Next, we're going to talk about overall environmental and social determinants contribute to multiple health outcomes such as chronic illness, respiratory conditions, stress, anxiety, fear, depression. These are all preventable with proper interventions in place, proper community involvement, even if it doesn't take anything but volunteers going to the bus stop, cleaning it up, making it great. Or even if it takes like people that are from a higher level of living that have more access to foods and nutritious foods, saying, hey, let's go open a pop-up food bank for the people of the lower income communities, and let's give them some non-perishables that are vegetables and fruits and breads and different things that they can have that are nutritious and of good quality value. So some solutions. Again, we have the food programs, we have transportation services, we have health education, and then we have community advocacy. So solutions could be community level interventions can significantly improve health outcomes. Community-based interventions such as food assistance like a food bank, food pantries, donation centers play a critical role in improving access to essential resources and reducing health disparities. Improving transportation services can increase access to healthcare, grocery stores, community support systems. Even if the lower income area of Shadowville does not have the proper grocery store, at least we can have transportation services in place. They can have a place to catch transportation to go to a grocery store where they can have that access. Health education provided by nurses and public health professionals empowers individuals to make informed decisions and adopt healthier behaviors. Policy and environmental changes such as improving housing standards and community infrastructure are essential for creating long-term and sustainable improvements in population health. We have to collaborate between healthcare providers, community organizations, policy members, health department personnel, governors, mayors, whoever it takes to make sure that everyone has health equity and they are all promoted on the same scale. All right, so reviewing key concepts and review questions, I want you to take a minute and think about what two factors are identified as safety risk. I want you to name one housing safety risk, and then I want you to list at least one food access solution and just reflect on the overall community aspect or impact that it may have. I want to give you guys a few seconds to do that. All right, in conclusion, awareness of environmental health risks is critical. By addressing these issues through education and community resources, we can improve health outcomes and reduce disparities. Prevention is key, community involvement matters, environmental impacts to health matters. Everything that we have talked about, if you have any ideas about how we can improve our community, please do not hesitate to comment below. So we're going to have a pop quiz. I provided a link below to our quiz. I think it's 5 or 6 questions that you can answer. It is a Google Doc, so your answers will automatically be graded. If you do need to replay this video for a refresher, please do so. And these are just any references that I have. I really appreciate you guys for watching. I appreciate you guys for listening. If you know of anything that can improve your community, improve the health outcomes of Shadowville, if you have any ideas, it will be, advantageous to just mention them if you can. Again, play your part in the community. If you see that you can gather up a group of people and they can go around, they can pick up litter and remove anything that'll prevent pests, any type of disease from happening, by all means, that would be great to do so. Again, my name is Chelsea Gregory. I'm a registered nurse here at Shadowville. Thanks for watching my lesson plan. Bye.